Namaste Bitya, Hamisha खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University. In today's lecture, we are going to discuss about thyroid disorders, goiter. This is a series of thyroid disorders in which we have discussed about various thyroid disorders that are commonly encountered. Today we are going to start with goiter. Goiter refers to the enlargement of the thyroid gland. So the enlargement of thyroid gland is known as goiter, and the common causes for goiter are biosynthetic defects, iodine deficiency, autoimmune diseases, and nodular diseases. So there are various causes for goiter like biosynthesis defect, iodine deficiency, autoimmune disease, and nodular diseases. In biosynthetic defects and iodine deficiency, these are associated with reduced efficiency of thyroid hormone synthesis, leading to the increased TSH, which stimulates thyroid growth. In Graves' disease, the goiter results from TSH resistant mediated effect of thyroid stimulating immunoglobulins. In Hashimoto thyroiditis, it occurs because of the acquired defects in hormone synthesis, leading to elevated levels of TSH and its consequent growth effects. Nodular diseases is characterized by the disordered growth of thyroid cells and often combined with the gradual development of fibrosis. Now we start with diffuse non-toxic, that is simple goiter. Diffuse enlargement of the thyroid gland in absence of nodules and hyperthyroidism. Most commonly, it is caused by iodine deficiency and more common in women than in men. The TSH levels are usually normal or only slightly increased. The abnormalities at each step in hormone synthesis, iodide transport, thyroglobulin synthesis, organification and coupling PPO, and regeneration of the iodide. The clinical manifestations of goiter, the thyroid functions is preserved and most goiters are asymptomatic. Examination of a diffuse goiter reveals a symmetrical, enlarged, non-tender, generally soft gland without palpable nodules. If the thyroid is markedly enlarged, it can cause tracheal or esophageal compression. Substernal goiter may obstruct the thoracic inlet. Now we come to Pemberton sign. In Pemberton sign, it refers to the symptoms of faintness with evidence of facial congestion and external jugular venous obstruction when the arms are raised above the head. It is used to evaluate venous obstruction in patients with goiters. The sign is positive when bilateral arm elevation causes facial plethora. It has been attributed to a Koch effect resulting from the thyroid obstructing the thoracic inlet, thereby increasing pressure on the venous system. This is the Pemberton sign. Look for the plethora, the facial plethora that is observed when the patient raises his hands due to the obstruction caused by the thyroid gland. Now the diagnosis. The diagnosis of goiter is done by low level of total T4 with a normal T3 and TSH levels. reflecting enhanced T4 to T3 conversions. There is low urinary iodine levels, less than 50 microgram per liter, that supports a diagnosis of iodine deficiency. Now we come to the treatment. The treatment consists of iodine replacement that induces variable regression of goiter, subtotal or near total thyroidectomy for cosmetic reasons. The surgery should be followed by replacement with levothyroxine. So this was all about goiter. In the next lecture, we will be discussing about multinodular goiter. This session was powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.